Topics in this video include acquisition screen interface options, Panorama patient positioning protocol, and Panorama appliance options. To take a 2D panoramic image with our patient chart up with an EasyDent Eye, we simply click on the Acquisition tab on the top of the screen and select Panorama on the panel to the left. It will then take us to the green CT2 interface screen to select our options. First, we begin with patient gender, man, woman, or child. Note, the system will automatically choose child if the patient is 12 or under. To the right of gender, we have exposure-based settings based on the patient's density or size. Options include hard, normal, which is your default, and soft. Moving to the right side of the screen under the panel options are the normal setting, providing a standard panoramic image, and the magic pan, providing a single optimal panoramic image having multiple focal images combined into one. Moving on to the image options below this are high resolution for best quality and the green setting for reduced radiation. Note, when using the green setting, the scan time goes from 13 seconds down to 7 seconds, making this an ideal setting for any patients that have stability issues. Next, select an arch size selection below. Options include narrow, normal, which is your default, and wide. Moving down to the panel examination area, standard is your default, capturing all dentition and condyles. Additional options include right side only, left side only, and front. Also notice the message information area on the bottom left of the screen, always displaying the status / next steps to take. Once completed, we can simply click confirm and the machine will rotate to capture position and we can move on to position our patient. In preparation, have the patient remove all metal objects from the neck up, including necklaces, eyeglasses, earrings, and any other metal objects. First, have your patient stand tall and about a few feet away from the machine and adjust the chin rest height to be about a ½ inch under the chin by using the column up and the column down buttons on the front of the panel. As you have the patient enter the machine, take care of the hands first, the feet second, and then the bite, in that order. Have the patient grasp the handrails with their palms facing up. Feet should be at shoulder width apart for stability. The goal is to have the spine as vertical as possible when biting on the bite stick to avoid spinal shadowing. In this example, we want that spine as upright as possible and chest close to the device, so we will have our patient take a step forward and notice the angle of the body. With a clean bite stick cover as a barrier, have the patient bite on the bite stick within the groove, firmly in place. As a tip, pull down on the bite stick to ensure the patient's chin is fully rested on the chin rest. Next, we move on to the laser beams, and first we will line up the mid-sagittal light and focus on getting that line through 2 anatomical points on the patient's head, one in the center of the eyes and the other at the philtrum area, so that the line is right through the center of the head. To adjust the position, move or tilt the patient's head to conform to the line. Next, we will line up the Frankfurt plane line. This is designed to run through 2 anatomical points on the patient's face, the tragus, and the bottom of the orbit. If the line is out of position on either point, press the beam up or beam down button on the front of the device to adjust. It may be necessary to angle the head manually to conform to the laser line as necessary. The objective of this beam is to have the head tilted to a natural head position and the occlusion at a 10-degree angle when positioned in the machine, which is what produces the slight smile effect in the pan. As a tip, it is a good idea to have the patient smile and view the 10-degree angle of the posterior teeth. Note, this applies only to the pan and not the 3D. Lastly, we look at the canine light. The canine light should be positioned directly in the center of the canine so that it displays on the tooth itself. To adjust the canine beam, move the lever on the side of the machine, left to right, to adjust. Have the patient smile and press on the cheeks if necessary to visualize the beam directly in the center of the tooth. Lastly, to ensure patient stability, press the temple support button on the front of the device and the rests will automatically close to stabilize the patient. Once completed, we can simply hit the Ready Return button on the front of the panel of the unit and the machine will rotate to the capture position. Have the patient close their lips around the bite stick, swallow, and have their tongue flat against the roof of their mouth and eyes closed. To acquire an image, hold down the exposure button, which will be lit in green, indicating it is ready to take an image, and will turn yellow once exposing, and hold. Once image acquisition is complete, the temporal rods will automatically open and we can release our patient. The image is then saved directly to the patient's chart within EasyGen Eye for review. Green CT2 appliance options. Chin rest with normal bite stick. Special bite B or edentulous rest with normal chin rest. Additionally, use a cotton roll to separate the bite. You may want to have the patient seated if necessary. Ideally, it is a good idea to use a chair with rolling feet and have the patient slide toward the device. The same protocol applies when the patient is seated. Have the patient hold in the underhand position on the handrails. Have the spine straight up and chest close to the device, and have the patient bite on the bite stick and continue standard panel protocol.